Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters. I think today is a very important day in the calendar. Today is World AIDS Day, and our focus is going to be on HIV and AIDS. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. All praises are due to Allah, and peace and salutations on our Prophet Mahomed sallallahu alaihi wasallam. Before we actually begin with the introduction of our guest speakers, we will start with a tarbiyah, and the discussion is on the power of the Holy Quran, the amazing effect resulting from listening to the Quran. The continuous listening to the recitation of the Holy Quran gives you such fruitful results. It increases the immunity of the body, enhances the creativity sense, improves the concentration ability, heals the chronic and incurable illnesses, changes behavior, and enables people to communicate better and gain trust. It also creates inner peace and heals the neural tensions. It heals nervousness, irritation, and precipitation. It improves the ability of making the right decisions, decreasing fear and hesitation, improves and strengthens the personality, heals the normal illness such as allergy, headache, flu, and other illnesses. It further improves the speech ability, protects from diseases such as cancer, and so on. It also changes some bad habits such as excessive eating and smoking. To conclude, there has come unto you an exhortation from your Lord, a healing for that which is in the breasts, and a guidance and a mercy for believers. Say, in the bounty of Allah and in His mercy, therein let them rejoice. It is better than what they hoard. Shukran. Jazakumullah al-khair. We will now begin with introducing our esteemed guests in studio. We have Dr. K. Mahomed, who is an HIV AIDS expert and clinician and who is in private practice. We have Dr. Nompumelelo Mthupha, who is a TB expert and is a clinician based at the Right to Care. And online we have Sister Honey Allee, who hails all the way from KZN, and she is also a celebrated figure who has received quite an award this year, Community Builder Award. So we're going to begin with Sister Honey Allee. Sister Honey, are you there?
Assalamu alaikum.
Wa alaikum salam, Sister Honey. I would like to begin with talking about World AIDS Day. There's a lot of hype around World AIDS Day, and the statistics speaks to 6.4 million people infected with HIV. Perhaps you can share with us more about this hype and all media sensationalism on the infection.
All right. It's such a pleasure to be on this broadcast. I just would like to just tell us that World AIDS Day is held on the 1st of December each year, and is an opportunity for people worldwide to unite in the fight against HIV, which is the human immunodeficiency virus that was first identified in 1984, right? And it also helps people show the support, at least this one day, for people living with HIV, and to commemorate people who have died in absolute ignorance. Shaheda, we have to be so grateful that we and our children, our families and relatives are being educated at the moment. Although there is the stigma, but we have this education and people are warming up to the education. So a World AIDS Day actually was the first ever global health day held for the first time in 1988. And since then, it has gone on every year. And those of us that are in the field know that this project is given so much emphasis and gains momentum on an annual basis. More people are buying into it, and it is a time to celebrate the lives of people that have passed on, but also to inform people and to renew their resolve to fight this epidemic. That's what the hype is all about.
Shukran so much. That's been so informative and enlightening about how it actually started and where we're at today, which takes us to the next question, Dr. K. Are we doing the right things in this country regarding HIV and AIDS?
I must say I feel very proud to be able to live in this country. I know our numbers are very high, but having looked at where we're presently at from where we were, I think we're doing phenomenal. Remember previously we had the government sending out the wrong messages, and right now I must say the government is sending out the right messages. Remember that everyone is being told you need to test and treat. We hear this all the time, and this is what we want. We want for everyone to test, because only if you test would you be able to know if you're positive or negative. And if you're HIV positive, what this is telling you is that you need to access care. You need to access care when you are well so that you never ever get ill. And not only are you accessing care for yourself, because when you access care, you drop your viral loads. And in this way, you prevent the spread of HIV to other people. So you prevent HIV from being spread as well. So the access of care to people who are positive is crucial. And that can only happen when you know your status. And if you're HIV negative, you need to ensure you continue to be HIV negative.
Thank you for that. I think what you're saying is very important about continuously testing and also knowing your status, and that there's no longer a stigma attached to it, which previously people were afraid to come out or come forward and seek any kind of intervention. Which takes us to the next question. Dr. Nompumelelo could speak to TB. What is TB and what is the link between TB and HIV?
TB and HIV are closely related because the one fuels the progression of the other. If you have got a TB, you are going to make your HIV worse, and you've got HIV, your TB is also going to be worsened. TB is an old disease. It has been with us even long before we actually knew that there was HIV. It was first diagnosed by Robert Koch in 1882. And he's the one who found out that TB is caused by a Mycobacterium bacillus that causes TB. It's a germ that is spread through airborne, such that when a person is coughing, sneezing, or talking, the Mycobacterium floats in the air and people inhale it, and then it goes into their lungs. The first infection, which is the primary infection, is usually contained in our lungs, and because in South Africa there's so much TB, all of us, we've had that first infection, which is the latent TB. Latent TB is non-infectious. The infection is contained in your lungs. It doesn't cause any problems. But once your immune system goes down, for instance, in people that have got HIV and other conditions, that TB might reactivate and become active TB, and you end up getting sick. Other people that are at risk of getting TB, it's very young children, ages less than 5, and the elderly. Women especially are more prone to have a TB and to die of TB in this day and age, because they get pregnant, they can get infected with HIV, and it sort of accelerate and exacerbate. But other people also can get TB. For instance, if you're diabetic, you're more likely to pick up TB. If you're working in the mines under confined small spaces, you can actually get TB. And also people who are on prolonged corticosteroid medication, transplant patients who are on immunosuppressive treatment, with, for instance, patients with cancers, they can actually be at high risk of getting TB. Patients who are, or people who are malnourished, people who live under extreme poverty, and people who smoke and people who abuse alcohol are more likely to get TB. The immune system are usually down.
So the immune system being compromised. But you said something which stands out for me about TB being airborne, whereas HIV is not airborne. If we can just speak quickly and briefly to that, because I want to move on to Sister Honey Allee then.
Yes, TB is an infection that is airborne. The mycobacterium can float in the air and remain suspended for about a period of 4 hours. So if you are in a confined space where there is not enough ventilation, there is not enough sunlight coming through, you are more likely to end up inhaling those mycobacterium. But it's only about 10% of people who inhale those mycobacterium that are going to eventually have active TB. In the 90% of people, in most cases, that TB is contained, and our immune systems are able to contain that infection, and it doesn't cause any disease. In a lifetime, a person who is HIV negative has got about a 10% of activating the TB or getting active TB and getting sick from TB. But an HIV positive patient has got a 5 to 10% chance of getting TB annually. That is why it's quite important that people should test, know their status, and they should always be screened for TB. Or if you're coughing, then you should make sure that you get screened for TB.
Thank you, Dr. Mthupha.
Shaheda, am I allowed to say something,
yes,
if you don't mind?
Okay, quickly.
Remember that we have our immune systems, and it is the immune system that protects us. So what generally happens is, if the immune system is compromised, and this is what the HIV virus does, it compromises the immune system, it attacks it directly, and this is why you're more prone to getting HIV, because you have a poor immunity. So you can understand why the interaction with HIV and TB is so strong, because the virus attacks the immune system, and when your immune system weakens, then you're at risk of contracting any opportunistic infections. And this is why you're so prone to getting TB.
Okay, Sister Honey, back to you now. What is being done by the powers that be to help fast-track the prevention of the spread of this disease? And what are the government initiatives that are being rolled out? Because you're really on the ground. You are the community barefoot worker out there working with HIV.
Right. But, you know, and just to add to the previous two speakers, I just would like people to know that the HIV virus is so clever that it attacks the immune system, which is really the white blood cells of the body, right? And the white cells of the body are what protects you, helps fight infection, and helps cure, right? But because it is so, the virus is so clever, it goes into this white cell and changes its whole brain and so on, and then that's when they start multiplying. And one needs to know that once you've got the virus, It will only go out to infect people, but it's not going to get away from your body, right? Now, that is where the government comes in so clearly, and this is what I like, and that is so many programs are being led by not just the government, but sometimes by NGOs that are powered by the government, and sometimes the government are the NGOs themselves, where education is taken right through to the grassroots, to the people. And we are trying then to work on fighting the stigma and discrimination and bringing this information to people and pushing them on to go out there and get tested. I don't know if you have heard, but I'm sure your speakers would tell you that the government is also pushing on to the fast tracking of this whole prevention program, which is called the 90 fast track program, where the government is working, and we are all pushing as the stakeholders to get 90% of the vulnerable population tested, and then 90% of the positive people who are ready, whose CD4 counts below 500, need to get onto antiretrovirals, and 90% of the people that are on antiretrovirals must remain on antiretrovirals and go on taking them no matter what the situation is.
Sister Allee, I'm going to interrupt you now. We'll continue. We're going to an ad break, and when we return, we will continue with your statements.
90.
Okay, with 90. Okay, thank you. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. Tonight in studio we have guests, renowned guests, Dr. K. Mahomed, a clinician in HIV and AIDS, Dr. Nompumelelo Mthupha, who is a TB specialist from Right to Care, and we have Sister Honey Allee from KZN, who's online. And we'll just pick up quickly, Sister Honey, on your 90 that you were speaking to about the program, if you can be brief so that we can move on. Thank you.
Okay. I just want to finish that off by saying that this is quite an ambitious program by the government, but it pushes people to get into the bottlenecks and to get in there, find the vulnerable population and send people to get out testing, and also making the test kits available for people to go out there and test people.
Shukran.
Okay.
Dr. Nompumelelo, I wanted to ask you, you mentioned about TB being airborne and talking about the immune system being compromised. So what are the symptoms that are manifested by patients that have contracted TB?
The symptoms of TB, especially if the person has got a TB of the lungs, is that the person would cough, but not all patients get TB of the lungs. TB can present anywhere. You can have TB meningitis, which affects the brain. You can have TB of the lymph nodes. You can have TB of the bones. You can have TB of the spine. You can have TB of the abdomen. So it can present literally everywhere in your body. But in most cases, the most common type of presentation is the pulmonary TB, which is in the lungs. If the person has got pulmonary TB, in most cases they will be coughing. The usual presentation is a persistent cough for more than 2 weeks. But in a case of a person that is HIV positive, the scenario changes. It can be a cough of even a 1-day duration. It doesn't have to be a prolonged cough. The second symptom is usually fever for more than 2 weeks. And another symptom is drenching night sweat, whereby the patient sweats a lot. In the middle of the night, they have to wake up and change their bed clothes. They have to change the pajamas. They have to change their pillows, or even put a towel where they're sleeping. And there is a substantial loss of weight, unintentional loss of weight of about 1.5 kilograms a month when the person is not dieting or anything. And then they usually lose appetite, and in most cases they get tired, they get lethargic. When they do cough, they might cough and produce blood in their sputum. Sometimes the patient will present with chest pains. Those are the major symptoms that you look out for.
So it seems to be like there's a cluster of symptoms, and of course one is to look at it over a period of time.
Yes.
Thank you. Dr. K, we haven't touched on circumcision and pap smears, and I know that's your hobby horse. Perhaps you can share some of that information with the viewers.
Sure. I heard Sister Honey talking about prevention, and I must say to all men out there, you need to realize, especially if you're HIV negative, that if you circumcise, your chances of getting HIV is decreased by 60%. So you can see just a simple procedure like circumcision, which is available at a lot of clinics and specialized centers and are done for free as well, will decrease the chances of you getting HIV by 60%. So that in itself is one huge prevention method. I don't know if you want me to mention a few of the other prevention methods or just go on to the cervical cancer thing.
Go on, it's fine.
Aside from having to do circumcisions, remember everyone needs to access ARVs. If you access ARVs and your viral load is undetectable, that is also another major way of ensuring that you do not transmit virus to other people, and in itself it is prevention as well. The other thing one needs to be able to remember, and especially to women out there, is a female condom. Remember, the female condom has a lot more advantages than the male condom, and one of the main advantages is that you can put it on in the morning and you can use it in the evening. It doesn't need an erect penis. You can use it multiple times in the evening. It is less prone to tearing and stuff like that, but most importantly, it puts the power in the hands of the women. So to women out there, know you can empower yourself and prevent yourself from getting HIV. And if you understand this, you know, if women get this message, I'll be more than happy as well to know that. Also remember that exactly like Dr. Mthupha says that TB and HIV go together, cancer of the cervix and HIV go together. So to women out there, remember you normally have 2 chances of a pap smear if you're HIV negative, that is when you're 40 and then when you're 50. But if you have HIV, you get the pap smear done a lot earlier. And cervical cancer is one of the cancers that's totally preventable. So by having a pap smear done as soon as you're diagnosed and regular follow-ups thereafter, you can totally prevent cervical cancer coming on.
Thank you for that, Dr. K. Sister Honey, coming back to you, I think being the community worker, and you're such a brilliant one at that, what are your thoughts and ideas on how the community should get involved with World AIDS Day? And with all this hype about World AIDS Day, what happens after World AIDS Day?
Okay, I just want to quickly say that with, as Dr. just mentioned, circumcision reducing the chances of you contracting HIV by 60%, I would like us to be very cautious about that, because working within the communities, especially in the very, very rural areas, people tell you, oh, I'm circumcised, so I don't have to use a condom. But so one has to be very, very careful on mentioning that even with a circumcision, you still have to wear a condom, and explain what this whole business of circumcision, how it helps. So I also feel that as a community, we need to, if all the people listening to ITV today can go out tomorrow and just educate 2 people, and those 2 people go on to another 2 and have the domino effect, then we will be doing some justice. And, you know, I never gave up on apartheid, and I'm not about giving up, even at this age, on the fight against this pandemic, which is killing the majority of our people. So we need to support and to be in solidarity with the millions of people living with HIV. Wear the red ribbon and make people know what it's all about. Make, World AIDS Day is also a great opportunity to raise money to help those infected and affected, especially child-headed households. We can run seminars at all different places with 5 people. Create awareness amongst your friends' children, your relatives, your children's friends, whoever else you think you need to educate, and find out where events are being held and attend these events. It's really, really imperative. I heard a professor say the other day while I was at a meeting, he says, this disease is not going away. The only way we can save ourselves is by keeping the uninfected, and people who have the infection should keep it to themselves and not spread it, and keep themselves healthy, lead a normal life, cover wounds, know how it is spread, and being faithful at all times. And yes, after this whole hype is over, Shaheda, I would like to say, join organizations that are working with child-headed households, working with orphanages, working with the infected and affected. Go out and become a trainer. Train people in the communities. You can do it. We can win this war, Shaheda. But let us all make a concerted effort, build relationships, and also people with children. Remember, God chose you to have those children. The children didn't choose you. It is your duty to know who their friends are, what they're reading, what they're exposed to in the social media, know where they are going, invite their friends over so you can build a relationship with your children. And there's so much that can be told about this. I'm so passionate about it, I can go on this whole show and more.
Sister Honey.
So I'll stop now.
Indeed, what you say is so powerful, and what you are also saying, if I can just sum it up, is it's not just World AIDS Day, it's World AIDS Day every day. And that
Absolutely.
It's everybody's right to access that information, but it's also responsibilities on every level by every individual to disseminate that information. So now thank you for that. We'll move on to Dr. K, and I want to speak to you. Mentioned antiretrovirals, and I think for the viewers' consumption out there, the difference between ARVs and PEP, post-exposure prophylaxis, so that people understand what you're actually speaking to and about.
Shaheda, I just want to go a step back, if you don't mind, before I get into the ARVs. I want to let everyone out there know that you need to access ARVs. The access to ARVs is at every single clinic. A clinic around the corner to you will have ARVs available. The government has shifted the care of HIV from doctors to nurses. The nurses are highly trained. They know as much about ARVs as the doctors do. So you cannot say you cannot access ARVs. And when you do need to access ARVs, it's quite simple. Your CD4 should be less than 500. Remember, most people whose CD4s are about 500 are people who are well. So if you haven't done the test, you would have no idea. Remember, every child under 5 can access ARVs immediately. Remember, anyone who's got a WHO stage 3 and 4 condition, and by this what I mean is that you're a little sicker. You have other opportunistic infections, like you're getting multiple herpes infections, you're losing weight, you have TB, you have cardiac relations, you have renal problems, you have other opportunistic infections. And if you have any of these things that are a little more severe, you can access ARVs. This is a clinical condition to make you access ARVs. Also remember that if you are in a relationship where one person is positive and one is negative, the positive partner needs to access ARVs immediately. So from what I've said, you can see we're trying to find many ways for people to access ARVs, and please take note of this and access the ARVs, because if you access the ARVs, this makes a huge difference in your life. Now remember, previously we used to have patients who would be on ARVs and you would take lots of tablets in the morning and lots of tablets in the night, and you would have lots of side effects. This is not there anymore. Now we're able to tell you, you just need to take one tablet at night only. And even if you cannot take that one tablet at night, it's not a problem. We will tailor make the ARVs to suit your lifestyle. If you're perhaps a doctor or a police and you're working shifts, we wouldn't give you the one tablet at night. We'll give you 2 tablets every night so you never get sleepy. If you're having a cardiac problem or a renal problem or a hepatic problem, or even if you're having TB, we will tailor make the ARVs to suit you. So not only are we tailor making the ARVs to suit you as to what is the best for you, we're also able to make sure that you take the treatment once a day and it'll fit into your lifestyle. So you can see from where we were to where we are is just absolutely phenomenal. And like I say to everyone these days, how many times a day do you eat? At least 3 times a day. How many times do you brush your teeth? 2 times a day. So if one is asking you to take 1 or 2 tablets once a day, it's really no big deal. It really is no big deal. And this is what I want to let people out there know. To say, even if you have HIV, so what? You just take 1 or 2 tablets once a day, and that is just how simple ARVs where we are right now with the ARVs. And even if you fail regimen 1, which is a regimen we put you on, we then have regimen 2, and even regimen 2 is made easier. So, and even if you fail regimen 2, we have regimen 3. So every day we have newer and better drugs coming out. So the access to ARVs is really very, very straightforward. It's not like in the past, and nowadays we don't even have any side effects from the drugs. So, you know, previously you would have like no bums and big boobs and all of that. Even that doesn't exist anymore. So there is no reason why anyone should feel bad about having HIV. This is, to me, a very simple, manageable, chronic disease. And one last thing. If you're HIV negative, you might never even see a doctor. If you're HIV positive, remember you're being monitored every 6 months. Not only are we checking your viral loads and making sure your viral load is undetectable for yourself and for your partners and for your communities, but you're having a blood pressure check, you're having a blood sugar check, we're checking your cholesterol, we're doing pap smears on you, so you can see you're getting so much more back.
Okay, so on that note, what Dr. K is saying is that you can live a positive and full and optimal life if you are on treatment and you follow your regimen. And on that note, we'll take an ad break and continue with Health Matters. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. Our guests in studio are Dr. K. Mahomed, Dr. Nompumelelo, and Sister Honey Allee from KZN, who's online. We ended off with Dr. K, but I'd like to begin with you now, Dr. Mthupha. If you could speak to how people can get tested. But before that, I would also like to just inform the viewers that we are opening the lines up for questions, and the number to call in on is 011 086 7777. Dr. Mthupha, if you can speak to the viewers about how people can get tested.
For you to get tested, you need to go to a clinic or a hospital where your symptoms will be screened. I've already mentioned the symptoms of TB, that if you are coughing, losing weight, having severe night sweats, and losing appetite, and also coughing up blood. What we need, if you've got you suspect that you've got TB, you need to go in to a hospital where you're going to produce a sputum. Previously, the sputum was the main first line of diagnosing patients. You'd cough, and then that sputum will be checked for the mycobacterium under a microscope after staining it with the Zil-Nielsen, and now we use an Oramin stain. But since 2012, our Minister of Health has done a great thing for South Africa, seeing the high risk of getting drug-resistant TB. He introduced us to the Gene Expect machine, which is a machine that was initially manufactured by the in the US Army for detecting anthrax that used to be sent with white envelopes. That Gene Expect now machine is being used for detecting TB, and it doesn't only detect that you have got the TB, it also tells you whether you have got drug-sensitive TB or you've got a drug-resistant TB. The same Gene Expect is being used to test for the human papilloma virus, which causes herpes, cervical cancer that Dr. K spoke about. So it's quite a useful machine that is being used. And when you do that Gene Expect, you can get your results at a point of care laboratory in 2 hours. In 2 hours, you leave the clinic or hospital on medication already. The other test that used to be, that is still being used, that needs to confirm as to whether you've got drug-sensitive or drug-resistant TB and what other drugs you are resistant to, is the culture. The sputum is cultured, but that one takes a long time. It takes about 6 weeks to turn positive or to give you an answer. And it will then be, some tests will also be done like PCR, where you are going to know whether you are resistant to one of the drugs, of which you will be mono-resistant if it's just the rifampicin. It also tests for INH resistance. If both these drugs you are resistant to, the isoniazid and the rifampicin, then it means you have got MDR TB, which is much more serious because you have got to take treatment for much longer. And then it also, you can also do a DST, which is a drug susceptibility test, which will be able to tell you whether you are also resistant to the second line drugs, your injectables, your kanamycin, capreomycin, and also your fluxacillin that is being used as a second line of treatment. If you are resistant to those, then it means you've got XDR treatment, which is an even more serious type of TB. So these tests, they can identify as to what a TB you have. Other tests that we've got you can do a urine LEM, which is sort of like a pregnancy test. You can test using that a urine and get your answer in 20 minutes time. It's much faster. It's more useful in those patients that cannot produce the sputum, but they can produce urine, because everyone, no matter how sick they are, they can produce a urine. In most cases, the HIV positive patients that are very sick, they cannot produce sputum, because the things that happen with the TB is completely different from a person with a normal immune system. So the urine test, you can get your answer in 20 minutes time to show that you have got a disseminated TB. And then chest x-ray can be used, but it's just a suspicion that you might have TB. It's not a confirmatory diagnosis. And in this day and age, it's not that useful, because then you don't know whether the patient has got drug sensitive or drug resistant TB. You need to know as to which TB is it that you have got. Other tests that can be done is your abdominal sonar. You can also do CT scans in order to find out whether the person has got a meningitis, or even in the abdomen to check for lymph nodes and also other conditions that can cause the TB. And the X-ray can also be useful in detecting if you have got a bone TB. For instance, the TB likes the spine, so you can have a fractured a lumbar spine because of the TB.
Thank you for that thorough explanation on being tested for TB. We'll just move on to Sister Honey. If you can just pick up on what points people should consider with regards to their own lives. You know, how should they take charge of their lives and what can they do, Sister Honey?
Well, I would like to mention that every one of us is responsible for our own lives. We ought to take control of our own lives, and we have to know what causes the disease, how you can get it, how it can be prevented, and we need to take this information from the topmost people right down to the ground. And I would like people to know that this disease doesn't choose color, doesn't choose wealth, doesn't choose or your standard of education. It affects everybody. And the sooner we start, the better it would be for people. I, for instance, have started working with, when she was 7, Amira, who is a granddaughter in our family, she started working with this condition when she was 7 years old. She even got the first page of the newspaper because of her talk, even at the City Hall. And I just feel so very privileged to be working with an organization, an NGO like the Islamic Medical Association and the Muslim AIDS Program, where we go out and start very young and talk with people. Today, for instance, I spoke at a creche, and the children were so attentive. You know, it just has to be age-appropriate, culturally sensitive. So we can all make a difference. It takes everybody to win this war.
I agree. I think what you're saying is, you know, that it's just appropriate that it's also 16 days of activism, and the theme this year is about Count Me In. And I think that collectively we can all make a difference. And what you are saying is that everybody needs to work together to ameliorate the situation. We're going to move on to Dr. K now. And what you said also is that it occurs across the spectrum, and that's what we all need to appreciate, that it has no boundaries. It's the best of best that get affected by this infection and disease. Dr. K, something that I think is important for you to speak to regarding the PMT and a positive person giving birth to a child. What are the chances or the probabilities of that child being infected?
Shaheda, I have to say that I totally agree with Sister Honey when she said we've come through bigger issues in this country, and I'm just as optimistic as she is that this is a problem we have a problem with now, and I think it can be sorted out very easily. The main message is one of education, which I totally and wholly agree with her. And I just want to explain in terms of the PMTCT program that a little bit of education and getting people involved can make such a huge difference. About 8 years ago, 1 in 4 babies was being born HIV positive. The mother-to-child transmission sat at 25%. What we did subsequently, we said to all mothers who were pregnant that you will access ARVs. And what this has done, by allowing every mum to access ARVs, we've brought the transmission rate from mothers to children to 2%. So you can see by giving the right message and empowering people to access ARVs, we can I think, and I'm very optimistic about it, let people know that if we could do it with our babies, where we brought the transmission rate from 25% to 2%, we can do this with this nation. We can all, if we need to access ARVs, and exactly like all pregnant mums, once you access ARVs, and you're not just accessing ARVs for the time that you're pregnant, this is access to ARVs for the rest of your life. And like the PMTCT program shows, that with the right education and getting people to access ARVs, if we could bring it down from 25 to 2%, I think nationally, not just with pregnant mothers, we should be able to do this as a nation as a whole. And this is my message to everyone out there, that the access to ARVs is easy, the treatment has no side effects, it can fit into your lifestyle. So go out there and access the ARVs and make a difference, because not only are you going to make the difference to yourself, you're going to make the difference to your partners and your communities, and at the end of the day, we will make the difference in our country. And the PMTC program is a prime example as to how we can get on top of things.
So what you're saying, Dr. K, is that people have a choice. They can remain a victim or become a thriver. They have the choice to take charge of their lives and move on in their lives and live healthy with the infection.
Absolutely.
So you've already given your message to the viewers. I'm going to ask Dr. Nompumelelo to give her message to the viewers. We've got 3 minutes to go, and if we can just go around with you all giving your messages, take-home messages to the viewers.
What I would like all the viewers to know is that TB is a curable disease, unlike HIV, which is a chronic manageable disease. If you take your medication correctly and complete the whole course, it doesn't matter whether you're given medication for 6 months, for 9 months, for 18 months, or 24 months. Make sure that you take your medication daily until you complete the whole course. And you do follow up even after you've finished to make sure that you don't relapse. We can cure TB if you take your medication. We can prevent the spread of TB in the communities if people are taking their medication correctly, and making sure that people don't die from this disease, which is curable, and making sure that each and every person, they know their status for HIV, because it's quite important that you know your status for HIV, and making sure that if you do get sick and you feel like you suspect that you might have a cough or cold, you go to a doctor and make sure that you demand that gene expect that I mentioned, that when you go to the hospital, you can be tested using the gene expect machine, using your sputum in order to find out whether I've got TB or not. And make sure that you are aware of the symptoms of TB. What is it that you have to look for? The loss of weight, the coughing, the loss of appetite, and the chest pains, and make sure that you are aware of it, and make sure that you stay healthy and you eat healthy and protect yourself. Most importantly, please open those windows wherever you are. Allow fresh air into your home, and make sure that if we are in a public space, if you are in a taxi or in a train, make sure you open those windows and there is ventilation. TB, a mycobacterium, cannot survive where there is fresh air and there is sunlight. It's only in enclosed spaces whereby it can linger on for about 4 hours. So let's make sure that we open our windows. It's summer now, it's hot, it allows us to do that.
Thank you, Dr. Nompumelelo. I think what you're also saying is it's about the fresh air, but also healthy diet and lifestyle. If we can move on to Sister Honey Allee, if you can be quickly and brief,
Okay.
and leave it.
I just want to give some encouraging news. In 2001, only 1 million people were receiving ARVs. 2015, 15 million people are receiving antiretrovirals. And this keeps the people working, supporting their children, putting food on the table. The global response to HIV has averted 30 million new infections and nearly 8 million deaths since 2000. We have, in South Africa, the biggest HIV treatment program in the world, with more than 3 million of our people on life-saving antiretrovirals. The end of HIV as a public health threat seems in sight. Let's all put our shoulders to the wheel. And just don't forget, one of the things you asked, which fell off the topic, is post-exposure prophylaxis, which is called
Thank you, Sister Allee.
Once you have got yourself, pricked with a needle, raped, or whatever, go out there and demand that you get your PEP.
On that note, we'll come to an end. Thank you to the illustrious speakers. I'm sure the viewers will agree that it was very informative, enlightening, and most of all empowering. And we will now end with a verse from the Holy Quran. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والأسر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. صدق الله العظيم. Until health matters next time. Assalamu alaikum wa rahmatullahi wa barakatuh.